Alright guys, hi, it's Dr. Emer. We're in West Hollywood in our new office. We're doing some great lives today. And we have a great case today where we're just going to do a little bit of facial sculpting on a younger male. Already looks really good. We just want to do some enhancements. You know that this is the year of the jawline. That's what I'm telling everybody. The chin and the neck is so important to people because they were always concerned about their face, and now they're starting to look down and realizing that we want to be chiseled, we want to have those strong facial features, and he already has, if you look, a really nice, strong anatomy. He's got a wider chin, he's got a strong jawline, but when the skin starts to get a little bit looser, or when we start to age, this area around the chin starts to lose some volume, you start to lose some of that definition. Same thing occurs in the middle part of the face. You work out a lot, there's stress, travel, etc. You start to lose some volume. So what we're going to do is help his under eye and mid-face area by doing a little lifting. We're going to soften that area using filler. We're also going to do the same thing on the chin. And then one of the things that a lot of people are looking at is non-surgical approaches to improving the nose area. So we're going to use a little bit of filler to just lift the tip of his nose slightly and give him a little bit of volume into the bridge. So we're going to use first one of my favorite fillers in men. It's called Radiesse, and it's a calcium-based product. And the reason I like it is, one, it gives you more longevity, up to 1.5 years. 2, helps build collagen. And 3, it gives a little bit more chiseling. You get more volume per syringe than a hyaluronic acid filler. So smile as big as you can. I want to show them the central volume you already have. Relax. And with men, go ahead and relax the smile. And with men, you just want to do very small bits. You're going to feel a little bit as it goes in. It shouldn't be too bad. We do very small amounts, 0.1, 0.2 at a time. I always tell people Radiesse typically swells a little bit more, so it looks a little bit more voluminous now than it actually will be in the next couple of days. So don't go crazy if it looks a little bit bigger right now, because one is it's mixed a little bit with some numbing. Smile again. Okay, relax, good. And then just to address some of the mid-face volume, we go underneath that depot injection and just kind of contour a little bit, just slow, soft, a little bit. Now, hold right here, and Danielle can do that either way. We'll go to the other side. And we're going to balance that. We're going to come now to the opposite side and do that same thing. Again, just some lifting through here. Good, relax. We're going to come all the way down, a little injection down to the bone. A very small amount. And again, we're going to go again. Good, perfect. And you want to do this on movement because you can always see where then the filler is placed and will be more naturally. And we just hold with pressure, go nice and slow. It's okay, I got it. And with men, we try and keep the volume a little bit more medial than lateral, but I want to get some lifting for him. Perfect, so go right there for him. Now I go back, and switch, and 1 sec. Perfect. Good. Let's take a quick look. Nice. So now we have a little bit of our volume, which obviously looks a little bit more substantial at the beginning, like I said.
How long will this last?
This will last up to 1.5 years. Let me see. Great. So now what I want to do is give some projection to the chin. Sorry, and we go all the way down to bone. And again, this has more substance than most hyaluronic fillers. So we're going to be able to really give him a nice look. Just hold firm pressure there with the gauze on his cheek. Focus for me, guys. Perfect. And with him, we want to create a bolder look, so we're going to go a little wider. Great. And I always tell people, look, it takes about 2 to 3 weeks for all fillers to settle. Because I had somebody email us today after 5 days saying everything's asymmetrical. I'm like, listen, you get there are pokes, it's swelling, you gotta give it a little time. It all settles in. And initially now even is not even the best time to look at it because it takes a little bit of time to really settle in. Now, since I know I'm not going to fully use all the filler on his nose, one of the things I want to do is some of that filler, which is a softer one, Restylane, I want to just put a little bit of it right above the chin area. This is called the lower cutaneous lip. We're going to use Restylane. This is lift. What is this one? Yeah, lift to give a little bit more substance here, because what this will do is a weird feeling. We're going to do this side right here, this little triangle, 0.1, 0.2, a little bit of a bold look. And will help balance out.
How long will the Restylane last?
This will be about 9 months to a year. Perfect. We're going to go to the opposite side. We're going to do that same thing. Right at that triangle where guys start to get a little bit of hollowing and lose and loss of that three-dimensional contour on their chin. This will really help soften that. So see, that really structured out his chin a lot more. Now, we're going to go to his under eye area. Keep your 27 gauge cannula. No. Yeah, there it is. Now we're going to go to his under eye and balance out. I don't know.
Someone asked if the glass walls had sparkles in them.
If the which walls?
If these walls have
They
sparkles.
do have sparkles. So you can see now this is already settling. Yes, it looks a little high right now, but that will balance out. What we're going to do is now we're going to go to his under eye, and we're going to use Juvederm Volbella. And the thing about Volbella is you want to make sure that you don't overdo it. This technology is made for small amounts. So we're going to use a 27 gauge cannula to limit any issues, because in the past from other providers he did have some swelling here. So we want to make sure it's just small little bits. You can see with the cannula we can go right up into that eye. And literally look at the difference. Fill out that under eye hollow right away. And this cannula is blunt ended, so I can go look all the way up here, right there, to the edge of the eye crease, and give a nice improvement. Good. Now let's do one last part on the eye here. Turn your head to the right a little bit. It's very important to do this corner of the eye. A lot of patients, this feels a little weird, bear with me. A lot of people lose hollowing and elasticity over here. They get more hollow. So by injecting some of the filler into the corner of the eye, you actually blend the whole tear trough. It makes the eye look so much better. Great. And then we'll use just a little extra on this side here. A lot of extra.
Someone said, love the new haircut, Dr. Emer.
Thank you. I'm telling you, it's the in thing right now.
And is Volbella good for starting out with filler in the face?
It is, but it's soft, so you have to make sure if you're going to use Volbella that it's in the right location, otherwise it won't last. So you want it to last. We're going to call it the Emer Hawk, like Tony Hawk, Emer Hawk.
Is Volbella good to use in the lips for the first time?
It's great to use in the lips for the first time. think that's one of my favorite places actually for it. Lips and eyes. So same thing on this side. Just do very little bits. Some people who normally get a little bit of swelling, it's good to put them under LED light immediately after, or do or give them a steroid pack. And so here we are doing a little bit all the way up. You can see into the eye crease. Perfect. Let's blend and blend. Now we're gonna go to the corner again. We're just doing very little bits. Some people get bruised, some don't. Guys usually look like they bleed a lot more during treatment and then usually don't bruise so much. Women usually look like they don't bleed at all and then all of a sudden they're bruising a couple days later. So we're gonna go again to that side area of the eye. Give just a little bit. Again, that corner. Perfect. We're going to blend. Perfect. Now, lastly, a little extra bit. Oh, actually, we'll probably don't need it. And go right into that area we did with the Restylane. Just to soften a different layer on the chin crease, just a little. Good. Okay. Now, I want you to hold right here with your right hand. Go ahead and hold. Your right hand.
Oh my.
Yeah, just start like that's okay. Just hold there. We're gonna have you do that on the left side as well. Good. The key is just to hold a little bit firm. Now what we're gonna do is I'm gonna lower you back a little bit. We're gonna re-wipe your nose. And we're gonna finish the facial sculpting with the nose filler. Now we've done this a couple times today. I did once on live. And it's a weird feeling, okay? You're gonna feel a pinch in the middle. Just keep your hands where they are. And what we're gonna do is I don't want to use a lot on him. Go ahead and grab that. See, he bleeds really easily, like I said, most men do. We're gonna go right into the nose. Okay. And I want you to take a deep breath in and breathe all the way out. There you go. Good, because that feels weird. We're going to do a little lifting of the tip. Can you switch me to the needle?
Yes.
Last one there. Good. So you guys can see already there's a little elevation in the tip of his nose. Thank you. And then just hold this right here for him. And that goes. Great. Okay. And now we're going to go right into where he has that little groove right onto the bone. Just do a little bit of volumization here.
Does nose filler last a little bit longer than other parts of the body?
Depends on the person. Some people who move a lot, no. And some people the answer is yes, and some it's no. Okay, go ahead and let go of both. Let me take a look at the nose. Hold on. Now, if you take a look, a little elevation of the tip. I got you this alcohol in there. And a little more filling out. You can see the nice curve. You show them there the nasal tip. And now let's see him when he's sitting up. We may end up wanting to do, lay him back a sec, lay him back. You guys give him some water for his eyes because the numbing medicine has gotten in there. Beautiful. Let me show you the nasal tip. Here. You okay? Oh, it's the numbing?
Yeah, a little bit.
Okay, hold on a sec. Hold this for 1 second in your hand. Just hold this. I'll give you some water. Hold on. So we can wipe you down. Wait 1 sec, because it's gonna be. Keep your eyes closed, because it's basically the numbing medicine and the alcohol has gotten your face. Lay your head back. And I'll wipe you, and then we're gonna give you some water. Can you grab some water? All right. And clean a little bit. You're in here, and then she's gonna wipe his eyes with a little water, because the numbing medicine always gets in there. No.
Yes.
All right, take a look here really quickly. Turn. You take a look there. You see elevation in the tip slightly, a little bit building of the bridge.
Absolutely.
I think we can do more, but the issue is I don't like to do that too much right off the bat because it puts the nose at risk. So it's good to kind of wait a little bit through here and softening the eyes, and then a little building out of the chin in that area there.
Absolutely. So
So I think that's good. I think when the swelling settles from here, what do you think?
it looks awesome. Yeah.
That looks great, right? I love, if you look to the side, what you want to see is the nasal tip should be a little elevated. This is the nasolabial angle. Lips, nose, chin, nose, lips, chin should all match. If we drew a line, and you can see right now the projection here matches each area, so we have nice facial balancing. So that's male facial contouring and slight micro-optical enhancement. Cool.
Very cool.
Let me look at you from the front.